Hi, this is Dr. Tony Mork, endoscopic spine specialist. Today I just want to show a brief video of an endoscopic division of the medial branch to the lumbar facets, which you don't always see, and actually is oftentimes considered small, which it usually is, but now and then you get a big nerve branch that you can see easily. So the goal is to divide the sensory nerves to the facet joint, the medial branch, and get enough distance between the ends so that the nerve sheath can't reconnect. This is the reason that just typical radiofrequency ablation only lasts for a year or less, is because the nerve sheath remains intact. So the way to do a definitive kind of denervation of the facet joint is to actually divide the nerve sheath, as we're going to see here. This is just a picture showing the medial branch. There's the transverse process there, and it always crosses going from cranial to caudal across the transverse process, and so that's the nerve we're going to see here. So most of the time the nerve is not visible, but occasionally it is large and visible, as we're going to see here shortly. And here we go. This is it. The transverse process, of course, is right here. So we're looking on probably the left-hand side. There's transverse process. This is the medial branch going posterior to it. You can see it very well, and we're going to see how we divide it. This is, of course, the nerve, and there's the sheath, of course, which we have to divide. Oftentimes, the smaller nerves, you don't see that, so you've got to be sure to divide the sheath when you're doing this endoscopically. But here we go, and the idea, this is just a very good size. This is what you see, and just note that it floats a little bit off the bone. Here's the grasper. Okay, we just go ahead and divide it like that, and that's all you have to do. Well, thank you very much. I just want to show you that the size that you can see on occasion endoscopically, and the reason that you do this endoscopically is for a permanent relief of pain, as opposed to doing radiofrequency ablation, which must be repeated on a every 9 to 12 month basis because the sheath remains intact otherwise. Thank you.